Okay, Amy, you just had a GLOW luncheon, and GLOW stands for,
Greater Longview Optimal Wellness.
right? And program's been going on a couple of years, I guess, right?
Yep.
And today was talking about how it's been doing, what the status of it is, and so what is the status of it?
We're finishing with the report we heard today was a 1-year report on just part of our data because we don't have both hospitals' data. It's really hard to get this data. So we're working to mature that so that we can have a look at our entire community as it relates to the GLOW program. The other part of the data that you heard today is based on zip code data. So that was based on census. The census that was given out and the data that came in looking at it by zip code. So that was not related to GLOW, but it is related to our community, and we can look at both of those aspects and see how they overlay and how one affects the other.
Okay,
When we're
and
talking
so
about emergency services.
yes, that's what I was going to ask you about because a lot of people aren't really aware of GLOW.
Right.
What is GLOW?
So Greater Longview Optimal Wellness is a 501c3. It's a collaborative. The city is the backbone. The partners are Gregg County, Special Health Resources, Wellness Point, Christus Good Shepherd, Longview Regional Medical Center, Greater Longview United Way, and I'm leaving someone out.
I'm surprised you got that far. It's a lot of organizations.
Yes, there's 8 of us in Gregg County. I think that was my last one. Greg.
Okay.
So we have a total of 8. So that is our collaboration.
And I guess the purpose is to try to get people to use a different service besides 911 for their needs. But
911 works as normal. You call 911 when you need help, and we don't want to stop that. But
Yeah.
what we want to do is when we identify users of the 911 system that have to use it frequently because they're not receiving the care they need, or maybe they're using 911 for social determinants or non-medical drivers of health, such as food, transportation, things like that. We want to work with them to connect them to our nonprofits in our community to get them the resources. Some people don't have the access or the web access or the different things that we commonly use to connect to information or resources. And so what we want to do is proactively identify individuals that need a little extra help, and we want to be there as a service in the community for them.
so I guess the way you're working it right now is you're identifying these people who are using 911, and maybe it's not an emergency, maybe they're needing something else, and then you're communicating with them.
Right.
Yeah.
Communicating, they have to sign a consent, which allows us to talk about their health protected information with them and then with the partners in the program. And then we don't do anything without the client's knowledge or that they want us to do. We just work together with them for resources we think may help with their needs. And if they say, yep, I want to do that, I would like you to help me do that, then we come alongside them and help connect them to the resources.
Okay. So get them help in a specific way that it will meet their needs.
Right.
I guess. Yeah. And then and then you had several people come up from UT, I guess.
Yep.
And it give you the data that they have been able to gather.
So UT Tyler has Episcopal Health Foundation, who was the original funder of the GLOW project. They commissioned UT Tyler to do an independent study of our program, and what the data they presented today was our 1-year study. We're in the middle of year 2. It'll end in December. I think it's December. And so then hopefully we'll have both hospitals' data and be able to give, so this is just a small snapshot of data, and we're already seeing a positive trend. So we're really anxious to get all the data put together so that we can really see what the trend looks like. But we do feel that it's going to trend in the positive.
Yeah. Now there's a lot of graphics used up there, and it looked like it's reduced quite a bit as far as, I hate to call it 911 abuse, but using 911 in the wrong ways.
Well, individuals that were having to access care through the 911 system, we were able to work with them and see maybe talk with them about what is the reason, and there's all different kinds of reasons that they would use 911 for their care in the emergency rooms. Some are lack of insurance, some are lack of transportation, are just not knowing. And so when we're able to work with them and connect them to resources, then their use of 911 goes down, which makes us available for more calls. And so we navigate them to the proper resources. Sometimes they'll go to the ERs multiple times because an ambulance in an ER doesn't satisfy their needs. And so they don't know where else to get it. And so they just keep coming back for that need. And so if we can help them plug into the right need or the right access point, then the care is taken care of. And that's why you see those numbers going down. They got the services they needed.
Yeah, so over the last year, those numbers have reduced. And then I guess this is something that is sort of a new thing in the state, right?
Yes, we are one of 6 accountable communities for health, which is this collaboration model. Most of them are not working on the same initiative that we are. They may be working on just food insecurity or just certain population needs. It depends on the community, but in our community, we are working on it collaboratively and starting with 911 users, and we have a really high volume of ED use, and so we're wanting to look at that and see why that is and how we can better serve our community. So we are one of 6 in the state of Texas doing this collaborative work. There are community paramedic programs all over the United States, all over Texas, and we'll be meeting with DSHS and HHSC on Monday in Austin to kind of have a roundtable discussion on the data challenges for proving up these programs, and then the challenges for sustainability for community paramedic programs like this one.
So what are those 2 groups you mentioned?
It'll be, that's who governs our hospitals, HHSC, and then DSHS, Texas Department of State Health Services, they govern the EMS. So we'll have state leaders there, policymakers to discuss, and then other community paramedic programs that are different from ours, but still there where we can come together and share knowledge, how their program worked, what we could do different. Maybe we'll learn from them, they'll learn from us, and just kind of develop these programs, because we see this as a future way to navigate individuals that are needing services.
Yeah, so this is something that could spread across the state.
Yes, especially for our size community. A lot of larger communities like Houston, Dallas, they have similar programs. And then smaller communities like ourselves, we're just now developing, so we have different resource availability, so we have to change our model a little bit from the bigger cities.
Yeah, and I guess each individual city would have to do that.
Yes, you have to see what resources are available in your community and then put together a program that fits your community and the needs of your community, because all communities have different needs. That's why looking at zip code data is really helpful for us to understand what are the needs in our area.
So it's looks like it's working out pretty well.
Yeah, it's doing great. We still have a lot of goals that we want to work on together in the future, and we hope we can continue to do that and improve our services.
All right, anything you'd like to add, Amy?
No.
Okay.
Thank you.
Thanks a lot, appreciate it.